you! If you're enjoying the Singing Teachers Talk podcast, then don't forget to hit the subscribe button. We are committed to bringing you engaging conversations and valuable insights from experts across the field of voice. By subscribing, it means we can continue to do that. You'll never miss an episode, and you'll be helping to spread the word to other singing teachers, vocal coaches, and overall voice nerds. So subscribe to this channel now and just watch your teaching grow. One of the TV shows I grew up watching was Sabrina the Teenage Witch on Nickelodeon, and I remember envying the powers that she had just to get something done or make something happen immediately with the swish of a finger. So, Lynn Hilton, if you had to choose one life chore that could just happen at the snap of your fingers, what would it be?
I think anything to do with housework and in particular cooking, because I used to have this motto that anything that took longer than 15 minutes to cook was too long, in particular if I had to cook it, for anything that was going to be pooed out at the end of the day.
So are you not into like slow cooking? I guess it's something else doing it for you, but a slow cooked bolognese?
I think that so the slow cooking's fine if I can just dump it in and then leave it to its own devices. But I came from a family of cooks. So my mum was a cordon bleu cook and my brother was a chef. And like my mum would start cooking 2 or 3 days before for a big event. And I'm like, why are you spending so much time on something that just gets eaten? Maybe it's appreciated, but really at the end of the day, it just gets eliminated. So yeah, what about you?
Well, I think I would have to choose the morning routine. I cannot be asked when it comes to washing my hair. I do wash my hair, by the way, and putting on makeup. I just cannot be bothered.
Well, actually, you could do that sort of wriggle of the nose or twitch your fingers. But what was it? The film, The Fifth Element, where they actually had this little machine where you just put it on your face or on your fingers and it just magically changed the color of your fingernail polish or your makeup.
Oh, yeah, that would be nice. That would be much handier than what I currently have to do. But if the same power applied to your singing voice, what would that be? What would you want to solve immediately with the snap of a finger?
On my voice or other
Mm,
people's?
yeah, on yours.
Hmm. Oh, for it to be ready and warmed up and ready to go without me having to prepare it. Yeah.
I think I just want to have an easier time in my head voice just right now, immediately without me having to really do any work on it. That would be great.
Mm. Yeah.
But Sabrina Spellman may have these magical powers, but they don't usually come without consequence. For example, I remember an episode where she gets upset when the school bully starts spreading rumors about her. So she uses this spell to make everyone start telling the truth, but it backfires. So he might be saying that Sabrina was just after a quick fix for the way she was feeling, and we can often go in search of quick fixes as singers. So, what do we usually mean by that term quick fix in singing?
Well, it's a sort of simple temporary solution, isn't it, to address whatever the immediate problem is. Uh, yeah, so it's just something, some instant action or resolution that's going to fix whatever the problem is.
Mm. And I think there's a key word in there, which is temporary. And if we look up the definition, we get faced with things like a way of solving a problem that is easy but temporary or even inadequate. So, firstly, when is it actually appropriate to apply something more short term like a quick fix?
Well, the time when I tend to use it is if somebody needs to do, say, a performance or an audition, and we don't have time to work on changing the technical strategies. So I might use a little trick, or I say trick with inverted commas, or strategy that will help the person get through that particular passage or on that note or that word. And that might be like a vowel adjustment or a physical adjustment. But in my mind, I would be after that, the ideal would be that you then work on it so that this now becomes a new way of doing it over time. Because these things, they are just temporary. So you can say to somebody on this particular word, add in this shape or vowel sound, but that doesn't necessarily mean they'll be able to transfer that into every other situation that's similar from a technical or acoustical point of view, because they don't really understand the principle and their body doesn't do it automatically at this point in time. So I think it's mainly for performances.
Yeah, and we recently spoke with Dr. Molly Gebrian on the podcast, and we were talking to her about the science of learning and practice. And in that, she shared how she can often help violists to quickly move their elbow into a new position. And a challenge that they were facing before actually can instantly be fixed by doing that. And clearly, this will depend on the singer and each individual scenario. And you've mentioned a couple there actually already, but what could be some examples of potential quick fixes in singing? So you've already said about the vowel.
It might be to do with mouth position. It could be to do with someone's posture. So it might be actually that just by getting them to align their spine in a better, healthier alignment, that actually sorts out some of the problem. Could be that they need to drop their jaw a little bit further or bring their mouth forward. Might be actually a mindset fix as well. It could be in this moment, imagine you're dropping down instead of thinking up, those kind of things.
Yeah. And sometimes we can even exploit the challenge, particularly in CCM and pop styles, to actually become something within our favor. So if somebody is having a registrational, whether that's acoustic or laryngeal challenge, we could say, well, why don't you play into the fact that on the other side of this, there is a flip and we're going more towards a yodel at this point, and just make use of that rather than, trying to find a quick fix, which may not actually be available in terms of blending the register immediately.
Well, of course, I mean, you could also change the melody line.
Mm-hmm.
Other things that I've done is change the key, just temporarily so you can get through this gig. Let's just bring this key down so that you can get through. It might be changing the order of the set list is another option, if that's available to the singer. Definitely done those kind of things just to get through the next performance.
Yeah.
It's a little harder when, obviously, if you're doing a show, you can't do that. There might be another option note-wise that is acceptable. Or maybe you don't hold the note for as long. That's another one. You don't need to sustain over 8 counts, just do it over 4 or 1. Or it might be that you do a little fall off at the end, or you slide up, instead of going straight into the note. Yeah, so there's lots of little technical strategies that you can do to find some sort of resolution that's acceptable. The thing is, you don't want to get into a situation where now that becomes your permanent strategy. We want to have control so that we can sustain a long note if we need to, bring in vibrato, do all the notes that are necessary to do, and sing in the key that we want to. So ultimately, that's why it ends up being kind of a quick fix. It's like, it's not how we want to be singing permanently, but this is how we're going to get through over the next performance or week or whatever.
When we apply these quick fixes, band-aids, little patches, if you like, some singers can ask the question, and I know some have asked me this before, isn't that just cheating? So what do you make of this term cheat?
Yes, I've never quite understood it, really. I definitely remember thinking it, but I think I was taught to think that somehow it was cheating. It's sort of a little bit like, so if you go into hospital and you're in pain and they give you analgesia to stop the pain so that you can breathe or move or just, have a tolerable life, that could be seen as a quick fix, because maybe you need an operation or maybe you need longer term treatment. But would you call that cheating?
Yeah.
And I'm like, no, that's just part of the treatment. It's just a strategy that we use to get through. So I'm not so keen on that attitude. I feel like it's probably important to understand that it's a valid strategy if it's going to help you deliver what you need to deliver and get through safely, and then give you the time later on to then go back and sort it out in a more long-term way. then actually it's just another strategy.
Yeah, totally agree. We have access to lots of different social media, YouTube videos, quick little Instagram reels. So, what role is this playing in singing and the idea that something can be solved quite quickly within a 5 minute video or a 5 minute little strategy reel?
It's difficult, isn't it? Especially if you're working with a beginner singer or someone who has very little experience of singing. It's the same with the TV competitions. There's this impression that somehow it's overnight success, and that can be very misleading. And I think it also not only misleads people in terms of technically, because they push their voice in a way that they maybe aren't ready for, or they haven't developed in their own voice, but it also has a mental impact. So people feel stressed or anxious because they haven't achieved whatever it is they think they should be achieving in that period of time. And I guess our role as singing teachers is to help put this into perspective with our students, to say, if that works for you in this moment, that's great, but wouldn't it be better to understand the principles behind it and then learn how to apply this into lots of different situations and not be reliant on, oh, in order to do this, I have to use this strategy. And then when I do that, I have to use that strategy. And here I won't have a strategy, so I'll have to skip it over, as opposed to really understanding your voice technically so that you can adapt it to different scenarios, situations, times of your life, and vocal health conditions as well.
Another consideration for social media videos is that there's not really anything individual about those tips. It's quite a generic explanation and a generic exploration. So even though they might be great tips for someone, it doesn't mean that they are great tips for everyone, and they might not apply. So if singers are out there trying out a video and it doesn't work, it doesn't necessarily mean that that's a bad tip. It just means it's not working for you, or whatever the experience might be. But who would be somebody that you would encourage people to check out on social media for some really great material?
Oh, I think someone like Dr. Dan, he's got some great videos. Justin Stoney as well is another person. Yeah, who do you listen to?
This isn't a YouTuber from what I understand, but on Instagram, I really like Emily Christian Morris's videos. She has some really great examples of singing a passage of a song in what's an M2 dominant place. Then she's going to sing it more mixed belt. Then she sings it in a chest zone, and you can kind of hear the subtle differences that happen. So I really like her material. Part of being student-led as a teacher is to give the singer some of that ownership over their lesson. But that can also result in the singer bringing different songs each week. And as you described before, just going through quick fixes. How can we quickly plug that thing or patch over that thing? So how do we ensure that as teachers, we can be student-led, but also encourage the student to focus a little bit deeper on the more long-term things than just quickly going between song after song?
My experience hasn't been that, to be honest. I think most of the people who, certainly I've seen, who've wanted to have singing lessons have understood that it's a process and that it takes time. But I think if I had someone who came in who wanted just the quick fixes, it would be just a case of having to sit down and explain a little bit more about the vocal anatomy and how motor skills occur and the psychomotor. Well, I wouldn't use those words, but just helping them to understand that we've got muscles and nerves involved, and it takes time to develop these things, and maybe find some analogies that they can relate to recognize that actually with singing, we need to work on the technique and develop it and build up the musculoskeletal system in terms of the technique. And then, of course, obviously putting in the practice for the performance aspect, or if you're doing musical theatre, then obviously acting through song, being a character. Or if you're an artist, the other aspects of being an artist. artist that come along with singing and songwriting, etc. So I think it's a matter of just gently educating the student and encouraging them to recognise that it's a process. It's not just about the quick fixes.
The quick fix, anyway, I guess this might be a bit counterintuitive, but it could be our way in to helping them want to be a little bit more invested in the longer term exploration. Because if they can have a tiny taster of what it's like to navigate something that feels easier, or actually which uncovers the problem a little bit more, then it might just be the boost that they need to go, okay, yeah, let's really dig into XYZ, whatever it might be that they need.
Definitely. I mean, for instance, I know that I've hooked in people very quickly just by giving them certain vowel and consonant combinations that I know are going to work with their voice issues that I've assessed, at the beginning of the lesson, and then giving them an extended arpeggio or that long scale or 1.5 octave scale, that whatever you like to call it. And then suddenly they're vocalizing up in areas that they may have never intentionally reached before, and very comfortably, because I've understood what's going on with their voice and how to counteract the issues. And that immediately you see on their face this amazement at them accessing a pitch that they've never accessed comfortably before. And I suppose you could say that's a quick fix, that I've given them strategically certain sounds and scales that I know are going to help with their particular voice issues. Yeah, so I guess I do it as a way of enticing people in to come and have more. The other thing I wanted to mention as well is that sometimes, especially when I'm working with very experienced singers, giving them a quick fix actually is just enough for them to know what to do each time, because they've been singing and they know their voice so well, even though they might not know exactly what's happening functionally to their voice, they know when it feels right and when it sounds right. And so if I make a slight adjustment, suddenly it's like, the penny drops. Oh, okay. So when I'm in this position, situation, pitch or sound or whatever, this part of my voice, if I make this adjustment, now I'll be able to access it without feeling strain or going flip or whatever it is that it happens. And actually, I don't have to work on the technique in order to develop it. The singer just will instinctively go where it is easier and more effective because they're very experienced.
I remember a while back we had Robert Susuma on the podcast talking about self-awareness and intention and things like that. And in that podcast, we were talking about how simply just bringing somebody's awareness to an area can be all they need to create the change. So even though that might be deemed a quick fix, actually it could be seen to be quite a successful one that can keep something going long term. Yeah. Actually, only a few weeks ago when Becky Gillespie was with us talking about singing for the self-conscious and actually overcoming that, part of what she was talking about was recording yourself as a performer and actually watching the video back. And I can remember being on one of my ship contracts thinking I was giving it the absolute beans on stage. And when I watched it back, I was like, bloody hell, I look so miserable. And at the time I was meant to be wheat, and you're bringing in the fall and the harvest. And I was like, Alexa, you've got to change what's going on your face, because there ain't much going on the at the moment. And after that, I had a real awareness and a conscious change of how I was presenting, and it felt better, it looked much better, and it just elevated the performance from there on out. And again, a quick thing to have done, but actually not one that had temporary results, it continued forwards.
Yeah, and I remember that similar thing when my teacher was saying to me, you need to open your mouth more. And I'm like, my mouth is so wide open. And then she put me in front of the mirror. I was like, like this. I was like, yeah, okay. It feels like it's open to me, but I realize now when I look at it, it's not anywhere near as open as it could be.
I'm just pressing the pause button on the podcast for a very brief moment to invite you to book your free BAST call. If you've been thinking about joining the BAST community through one of our courses, but you just don't know which option is the best for you, then why not book your free Zoom chat with our very own Kimberly George, who has all the answers. Head over to basttraining.com/book-a-call/ and click that big blue button. That's basttraining.com/book-a-call/. Now, where were we?
So actually, we've kind of explored how it can be of benefit as well as something that is a little bit more temporary in its nature. Thinking about lengths of time, now I always want a definitive answer to these things, but I'm coming around to the fact that maybe there isn't one. Just as Dr. Molly Gebrian was explaining, the length of time it takes for a person to create new and myelinated pathways in the brain is going to differ. And in learning and creating new habitual behaviors, the brain actually has to make these physical changes, and that is just variable amongst us. With that considered, if we're working with a singer on, say, something like registration or one of the more longer term technical bits in our voices, so to speak, roughly how much of the lesson time is that taking for how long in said amount of weeks, would you say, in your experience as a teacher?
Certainly in the beginning, I might spend a little longer on that. So say if I've got an hour lesson and it's not a fatiguing type of vocal quality, then I might spend 10, 15 minutes trying different ways in, exploring and getting feedback from the student as well. How does that feel? What do you think? Is that something that's easily accessible for you? Does it make sense? Is there something else that I can add into that to help you understand what it is that we're working towards? So I probably will spend a lot more time in the first lesson or two. And then afterwards, I'm expecting the student to be going away and practicing that, because that's where the changes happen, or the myelination that we were talking about happens. Then I might just revisit it. Let's check in with this. How's it going? Here's another thing you could add into it. This is how you could progress it from here. We could now adapt it into another situation. So that might only be, a few minutes. So it really depends. And it does have a lot to do with how fatiguing it is on the vocal folds. So when I'm, for instance, working with belt, I may not work for 10, 15 minutes on belt with someone who's brand new, who's never done it, who generally has weak vocal fold closure, is just not used to that kind of a sound. I might only spend 1 or 2 minutes and then move on to something else. I might come back to it later in the lesson just to re-establish it and reinforce it, and then give very specific exercises with criteria to judge, whether it's working or not working, or causing some sort of impact, negative impact on the voice. So it does depend a little bit on the kind of strategy that I'm working around. And I would expect, very loosely, please don't quote me on this, but for things that are brand new and that require a new neural pathway, or I would say a few months to become second nature, but it really depends very much on how much time that person spends during their own practice session.
And obviously, working back to what Molly says, how they're practicing as well.
How they're practicing. So if it's brand new, obviously I'm going to give it a lot longer, and that might be some months. If it's a new habit that is circumventing an old bad habit, say, for instance, someone has a tendency to raise their larynx a lot while they're singing up into the higher part of their range. And they're in particular males who are rock singers who tend to use a lot of extrinsic muscle to try and push out those sounds. That might take a year or so, because it also depends on what they're doing during the week. So, for instance, I had a rock singer, and he was going out every weekend and singing and performing, but he couldn't incorporate the new ways into his performances because we were right at the beginning of creating this new habit, and it would have actually ruined the sound that he wanted. So I just said to him, just keep doing what you normally do when you're performing. And then when you're practicing, be working on this new stuff, and we'll just gradually over time start to try and incorporate it into your songs. And it might be that we have to get a brand new song that you've never sung before to actually apply all of this new strategy to, because every time you go back into your old songs, you'll go back into your old habits. And I worked there was probably a good 2 years while we were working to get him to change that, till it became much more natural and easy, and he could apply it even to songs which he'd been singing in the way that was causing problems. So how long is a piece of string answer? And I think it's really important to point out that everybody develops at a different rate. I mean, if you think about people who go to the gym, I'm sure most people have heard somebody say, doesn't matter how long I spend in the gym and how many weights I lift, I just don't put on muscle. And then others who just as much as look at a dumbbell and their muscle starts to build up. And it's no different in the voice. Sometimes it just takes longer. I've worked, with one particular singer, I would say, for about 7 years on her transition. And we knew we were progressing, things were changing, but it was a big voice. There was some anatomical things that I think challenged us, and also a lot of habits that we had to change. But it probably was, I would say, around the 7th year where she really felt like everything was in place and she knew exactly what she had to do when she was singing, no matter what she was singing. And she felt like this was now second nature. I wouldn't say that was normal, by the way. That was an exceptionally long one, and I had to check in with other people all the time to see if I was still doing the right thing, because it did worry me. But it also was a really good lesson to me to not have too fine an expectation on how long someone can take to develop.
Unlike other musicians who can put their instrument away at the end of the day, and the only time they pick up that instrument is to create new habits or to practice or to play in a particular way, we don't ever get away from our voices. So how can those things that we're working on more long term happen when we're still using it in other capacities and other scenarios?
Well, firstly, I think we've got to give ourselves a break and recognize that it will take time, patience, and effort. I would also highly recommend, as Molly was talking about, the mental practice, engaging that. And sometimes I'll say to students, find a singer who already does this in the way that you want to do this, and imagine that you're them and sing along in your imagination with them, imagining how that feels and sounds within your own body and your own head and ears, and do that over and over again until that feels like you're doing it. You're doing what you are physically doing, what they are vocally able to produce, so that you're training your body and your brain. This is how I want it to feel. This is how I want it to sound. This is what I want it to look like. So that could be another strategy that you could engage. But I think the most important aspect of it, especially if you're trying to change habits that you've had for a very long time, maybe even since the beginning of when you started singing, it's just going to take patience and time.
I think that patience and time has to transfer over to the teacher as well, because sometimes it can be a little bit frustrating for us if we feel we've been working on a particular thing for quite a while, but we're not noticing the changes that we would like to. So when we are reflecting on our work and we're reviewing the lessons that we're conducting, how can we challenge the amount of time things may be taking, whilst considering that it does have variable amounts of time to maybe move along?
So maybe you could start by making sure you're getting feedback from the student. Is that better, worse, or the same? Because you might not notice the change as much as the student does. So I think a lot of teachers make an assumption. Also, maybe setting up some criteria for yourself in terms of what kind of shifts am I looking for? How far should it shift? Over what time? So that you've got a way of measuring progress. Going back and listening to earlier recordings to recognize that actually probably something has shifted and you haven't maybe noticed it because you're seeing it day in, day out. Yeah, so those kind of strategies might help. And also maybe getting the student to have a lesson with another teacher while you observe to see what approach they take and see if that makes any difference. That's definitely something which has been useful to singing teachers in the past, is actually taking their student to someone who's more experienced, sitting in and observing the lesson, seeing what other approaches might happen, but also most of the time what happens is that they start to recognize they're actually on the right path, they're doing okay, and they're not doing anything terrible. It's just taking time.
Yeah. I think also if we can map out what's happening between the sessions, like I sometimes ask students, send ahead your practice journal or whatever you're doing. And you might notice, okay, maybe we can help them with a more efficient practice strategy. But also if you notice that actually somebody is really busy and hasn't been able to practice for 4 weeks, we can't really expect things to be wonderfully further down the line, even though we're starting to make changes of awareness or understanding. So those things are still really good, but we can't expect, overnight success, as you mentioned earlier, to happen when there's other things that need to be in place for that too. So maybe some visual graph or something that just helps you to consolidate actually what's going on with a bit more perspective. So, Lynn, we've touched on why quick fixes could be a good thing for the person going into an audition very soon, or a performance, or just to bring about a type of awareness. But when is it not a good idea to apply a quick fix?
Yeah, so a very classic time that singers want a quick fix is when they've got a bit of a sore throat or coming down with a cold, but they've got to have a gig on the weekend. There's something they can do, and they might say, oh, well, if I take some paracetamol or something to hide the pain, would that help? Or if I numb my throat and then I can go out and sing? And I would say, absolutely not. Because if you've got swelling in that area, you've probably got swollen vocal folds, and they're going to be much more at risk of some sort of vocal pathology or injury if you go out and sing. Because all that happens if you numb it or take a painkiller is that you mask the pain. And so you might think everything's all right, but actually the vocal folds are still swollen. And so you're more likely to cause damage because the vocal folds, when they're swollen, are more vulnerable to injury. While I'm on that point, I want to also remind singers that ibuprofen and aspirin are also probably best to be avoided unless obviously they've been prescribed by a doctor, because they can also put the vocal folds at risk of hemorrhage or polyps, especially if you're singing in a very extreme way, like belted singing or using your voice a lot. Or they might say, oh, shall I have a steam or a nebulizer? And if you're interested in understanding more about nebulizing and steaming, then the Naked Vocalist have a very good article on that. So whilst obviously our vocal folds will always appreciate more moisture, external and internal, it's not going to fix the problem. If your voice is sick, you really should be resting it. If you go out and sing, even if you can't feel the pain, then you're putting yourself at risk of an injury.
And just to touch upon what that rest is, because we understand a little bit from the sports science world about how a gentle SOVT siren could be classed as the bit of rest that you do rather than complete stumm.
Yes.
Is that what we understand at the moment?
Yeah, so someone who's on complete vocal rest doesn't speak or sing, but that would come from an ENT laryngologist or an SLT. Mostly when someone says rest your voice, they're meaning singing related. And then you talk normally if it's comfortable. I mean, if it's really sore, like say if you've got laryngitis, it can be really, really sore, then don't use your voice, text or write it down. But as soon as it doesn't feel super painful, it's okay to do things like SOVTs and straw work. Yeah.
Any other quick fixes, Lynn, that you would like to tell us about?
Well, I was thinking about this earlier and thinking that actually using things like mental imagery, meditation, hypnosis, or breathing strategies, they can be deemed as quick fixes to help people to overcome anxiety if it's having an impact on your voice or your performance, or to help you focus on delivering the kind of performance that you want to, or shift your mindset around a performance. So those things could be deemed as quick fixes, definitely useful.
So overall, we're really saying actually quick fixes can be a really useful tool. They can make us get something a little bit more with immediacy and feel like things are even more accessible to us in the singing world. But there are times when actually there are more long-term things we would likely want to put our focus to make it a little bit more ingrained and learned across our performance life.
Yeah, and I'd love to hear if people have any other comments to make about quick fixes and their thoughts on whether it's a good or bad thing, and any other quick fixes that they may have come across. Yeah, because obviously the more we have, the better for everybody.
Lynn, give us the updates from BAST HQ. What's going on?
Oh, so I'm just in the process of finishing off delivering all the online version of the BAST 20-hour course, so the foundation course as we're calling it now. So if anyone's interested in doing the foundation course or what was the old 20-hour course, it's still on a great big discount because at the moment people are having to wait for me to finish all the content. So I would say you probably have another couple of weeks left if you want to access that course at a big discount, and I can't remember exactly what the discounts are. So what I can tell you though is that you can either just do the course, which is all online and it's self-paced. We have all the different modules with the different lessons, and each lesson has a pop quiz with it. Then if you're interested in having a little bit of one-on-one with a mentor, you can go for the Foundation Advance and you can get a mentor session with either yourself, Alexa, or Kim. And then if you would want to have myself or Kaya as a mentor, then there's the Foundation Excel. So obviously these are all different price levels and they will go to the regular price as soon as I've completed putting all the work up. So if that's been of interest to anybody, then now's the time to get in. Then we've got obviously the new cohort starting in September for the RSL Level 5 qualification, the extended diploma. We're now in our halfway through with our first cohort, just about to finish term 3. And we've got a new cohort that started in April. So they're just getting started and all excited because they're learning all these new things that are helping their voices and their students' voices. So that's mainly what I've been focusing on in the last few months, and I'm hoping to have a little bit of a break over summer.
Great. So where can people get in touch and sign up for that juicy discount on the foundation course then, Lynn? And is there a date that it closes?
Well, I would say certainly by the end of July 2024, everything will be up and then we'll be ready to shift over to the regular prices. And you can just DM us through any social media or email us info@basttraining.com and we will make sure that you get access to the discount codes, etc.
Great. Well, as always, thank you for joining me today, Lynn. And I tell you what is a very reliable quick fix is a cup of tea. So I think it's time to put the kettle on, I think.
Brilliant. I'll look forward to enjoying the cup of tea as well. And I'll see you. Thanks for your questions and wonderful conversation.